So what's the tie between lipid profile and heart health?
Numbers give us a false sense of security.
Is it possible for a thin, lean person to have a bad cholesterol profile?
Food doesn't contribute to the maximum cholesterol number.
So welcome to the program, Doctor, and it's a pleasure to have you.
Dr. Lakshmi, good morning.
So saving hundreds of lives, split-second decisions, and turning heart-stopping moments into life-saving stories. So how does this journey feels like?
This journey is quite enjoyable, and at the end of the day, it gives a quite fulfilling experience for me when I return back home. So saving the lives, learning every day from whatever opportunities what we get in treating the patients, and how to become as a part of my standard operating procedure for the next patient is something which is very important, which I look forward every day when I start with. So this constant quest for excellence and constant quest for improvement is one of the motivating factors for us to work in a typical day. Like today, you can see me working from around 8:39, and I usually close my day around 9 p.m. So 12 hours looks like a breeze. I start the day the same way and end the day with the same way. I do not feel exhausted. The only exhaustion I feel is when I go back home. When I go back home, there is a time when I get exhausted. Then I realize, oh, I don't even realize that I worked so long, but I feel that the exhaustion sets in when I get back home. So it is very important as a cardiologist, an interventional cardiologist after about 25 years of working in this field, I think we need to be fit to work for long hours. And then this journey is not going to stop any sooner. So it is going to last much, much longer.
Undoubtedly, work is your passion and work is what gives you energy. Cardiac awareness or cardiac health awareness is on the rise. People are getting regular health checkups done. And one such common test is lipid profile. So what's the tie between lipid profile and heart health?
So lipid profile is a common blood test to assess the amount of cholesterol or chikunai in the blood. So this lipid profile contains multiple subtests. Most of the time, colloquially, lay people say it is a cholesterol test. So in this cholesterol test, there are certain cholesterols which are good, certain cholesterols which are good, which are bad for the heart or bad for the vessels. Now, beyond the total cholesterol, we'll have the fraction of the LDL cholesterol. That is what is the low density lipoprotein, but I don't want to confuse the people. LDL. So total cholesterol, LDL cholesterol. That is the LDL cholesterol is the bad cholesterol, and this bad cholesterol gets accumulated in the blood vessels and causing blockages of the arteries. On the other hand, you have a good cholesterol which protects your blood vessels. That is what we call as the HDL cholesterol. So the LDL cholesterol is bad to the body and HDL cholesterol is protective to the body. Then we have one more subfraction, that is the triglycerides. So the triglycerides are the fraction for which the evidence is not strong, but that's why we say that it may possibly contribute to the development of heart problem.
So you've clearly explained that not all cholesterol is bad, but you do have some good cholesterol and that's really good for the vessels. So talking about the numbers as you were mentioning, so is there any particular range or number that makes you sit up and just wonder what is this test? What is this number?
Yes. So we need to understand previously when we used to have the lipid profile, we used to have the total cholesterol was our target. But now the focus is not on the total cholesterol because we understood that total cholesterol encompasses good and bad cholesterol. So obviously total cholesterol is not our metric to say which is this one. So what is the cholesterol which we should focus upon is the bad cholesterol, that is the LDL cholesterol. So this number, let us say I do all the math using a formula. Nowadays, we have on the mobile phone the apps. So with that app, I estimate the risk of the person, whether the risk is 5%, 10%, 2.5% risk of developing heart problem in the next 10 years. So that will allow me what is the preventive strategy or what is the protection strategy I need to give to that person for a normal number. So one should not look at a particular LDL number or a particular HDL number to be protective, but instead we need to take the multiple parameters. A health checkup, a person spends about 6,000-7,000 rupees to get a health checkup. At the end of the health checkup, it is not enough all your reports are normal or all your reports are abnormal. We should make them understand that what we do in our hospital, like, look, your risk is 6% risk. So if an Indian at a 6% risk, you need to take a statin. Okay, you have got additional diabetes, so you need to add an aspirin to you. So we avoid extra medicines, but at the same time, we cannot avoid giving those medicines which will give protection to them. So that is what is the risk model incorporation into our preventive checkups that helps you to deliver a much higher and enhanced level of care.
So you're not just looking at the numbers or treating the numbers, but you're looking at the overall picture and how the person would be at risk in the future for the heart diseases. Yeah. So talking about these tests, are there any particular group of people or is there any particular age that you should kickstart or get these done frequently?
Yes, it's a very important question. So diabetes, chronic kidney disease, hypertension, and then family history of heart-related problems. So if a person had a family history of sudden death or a young MI, that group of patients, I think we need to start screening early. So what is the age at which one should have a lipid profile? As per the guidelines, the first lipid profile should be done at the age of 18 years. So at the age of 18 years, the screening should start. So then how frequently the screening should continue is if the person does not have any risk factors, he is young at the age of 18 years, every 5th year he should get a lipid profile and the rest of the test done. Beyond the age of 40, every 2 years, but I implement my practice every year, one should get this lipid profile, HbA1c and all those things done, because the early we detect, we will be able to take steps faster.
And also, doctor, there are a lot of myths around this lipid profile test. People just look at the numbers or they think that fasting is the only way, or they avoid certain foods just before the test is done so that the numbers would be,
Yeah, you can fudge the
correct.
numbers.
Yeah.
Now, these numbers are misleading because the first thing is they are for normal population. They are not for diseased person. So, if a person who had a heart-related problem, diabetes, hypertension, kidney disease, these numbers do not apply. That's the first thing which we need to understand. Then the second thing is we already understood for a normal person, it is not the number of the lipid which is LDL which is important, but instead the global risk what we need to estimate which will give us the exact risk of that person. For example, LDL might be 120, but if he has got diabetes, if he has got a elevated creatinine, if he has got a low HDL, then the risk is much higher. So that is how you need to look at the risk. Then the third point is numbers give us a false sense of security. So what is the LDL goal? That is what there is a continuously, the lower the better. That means if you get your LDL less than 10, for example, then I think there is a very low chances for that particular person to have a heart-related problem. Now, you might come ask me, is it possible to achieve that number? Yes, certainly. We see a lot of our patients, we aim to bring the LDL to less than 30. So when we are all born, the LDL is 0.
Oh, that's interesting.
That's good. So when we are all born, LDL is 0. As you progress in the age, 7 years onwards, it goes up to 10, 15, 20.
Keeps on increasing.
It keeps on increasing with the aging.
How about fasting versus non-fasting lipid profile? I mean, is it the same or is there any difference?
In a fasting state, how many hours in a typical day we are really fasting is not too much. So if you do a fasting cholesterol, it might not be really representative of the true risk what you have. So the guidelines have changed in the last 1.5 decade, and we now start doing lipid profile as a non-fasting sample rather than a fasting state. Now you were asking that is there any way that a person can cheat the test by fasting or not eating a typical food for the previous 1 week or 10 days and come for the test? It is impossible. But Dr. Lakshmi, it is a myth once again which we need to bust in this session is food doesn't contribute to the maximum cholesterol number. The diet contributes to only 30%. That's the first thing. The rest of the 70% is genetically predetermined.
So let's not just blame our ancestors and our genetic makeup. We still have to follow some lifestyle modifications.
Certainly, lifestyle modification to keep a caloric deficit. You need to create a caloric deficit by lifestyle, and at the same time, it is not enough that you rely upon the diet only. So, if you look at diet alone, it reduces the lipid numbers by 8 to 10%. Exercise alone, it reduces the lipid numbers by about 8 to 10%. And if you combine exercise with the diet, it together it reduces by about 15-16%. If you want to reduce the LDL cholesterol to a low risk group, it is not just with diet and exercise alone. You have to take the support of the medicines too.
Another thing, Dr. Raghu, I would like to ask you is it possible for a thin, lean person to have a bad cholesterol profile and also vice versa?
Yes, it is very much possible. The cholesterol is a genetic product, and only 30% diet and exercise product. So lifestyle is only 30%. So 70% is contributed by the gene. So a lean person can have high cholesterol, and a high fatty person can have a low levels of LDL cholesterol. That is where in our day-to-day practice we are understanding that we have a entity called as the familial hypercholesterolemia. It is very common in our Indian population also. We do find these patients, and this is a genetic type of elevated cholesterol. But the most important thing what I wanted to tell you, this applies to the doctors who are watching this or listening to this podcast, is they need to take statin. Any person has to take statin. Statin is the foundation. On this foundation, you can give any of the new drugs. So that is how the therapies have to be built.
And finally, Dr. Raghu, if someone hasn't checked their lipid profiles over the years, what is that you would like to tell them?
They should get the lipid profile done quite immediately, I think I would say.
It's never too late to start.
It's never too late to start. And it's not enough that you get the test done. One needs to go online or look for some advocacy groups or research, then try to understand what is the lipid profile and have a proper minimal understanding, because it is not enough somebody has got financial literacy or professional literacy. A health literacy is also very important for them.
And are there any heart healthy habits that we should follow regularly?
Obviously, maintaining a caloric deficit, eating heart healthy diets like greens and vegetables and fruits and vegetables, that's what we say. So multicolored food, raw rather than fried, and physical activity. These three would be the major pillars for them to prevent the heart related issues in a longer run.
So thank you, Dr. Raghu, for such an inspiring and empowering podcast. This definitely was a lot of information. I'm sure this would be helpful for our viewers as well. So thank you.
Thank you, Dr. Lakshmi. Thank you very much.